at 1 o'clock, so we'll get started. So hello again and welcome to our workshop on SSI, SSDI, and Medicaid. What you need to know to help your child or youth get and keep disability-based benefits, with Barb Prine, staff attorney at Disability Law Project, and Mark Hengstler, law clerk at Legal Services Vermont. All of our workshops, including previous ones, are recorded and can be watched on our VFN YouTube channel. The link is on our website, familynetwork.org. Everyone who registered for today's workshop will receive a follow-up email with a link to this recording. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. Today's workshop is being recorded, so please keep that in mind as you share information about your situation in the chat. These sessions will include live captions. If you want to turn them off, click on Live Transcript, then Hide Subtitle. If you are comfortable, you are welcome to turn on your camera. You can ask questions using the chat box, which you'll see at the bottom of your screen. Feel free to share information or links to resources that you found helpful in the chat as well. We know that we can learn a lot from each other. So I am excited to introduce you both to Barb and Mark. Thank you both so much for joining us today.
Hi, I'm Barb Prine. I'm a staff attorney at the Disability Law Project of Vermont Legal Aid. And with me today is Mark Hengstler. He's a law clerk at Legal Services Vermont. And we are sister organizations that are basically your free civil legal services. You don't really need to know the differences between the two of us because we're going to share our phone number and how to contact us if you have a legal problem. Legal Services Vermont sort of acts as the intake unit for legal aid, and then legal aid, some of the cases stay with Legal Services Vermont, particularly around the SSI and SSDI. Other cases get given to Vermont Legal Aid, particularly other disability-based issues, special education, unemployment, working and keeping unemployment, access to Medicaid, things like that. But none of that matters because we'll figure it out between the two of us. We're in the same building and we're here to help you. One thing I do want to say, they put in the chat how to get into access to us. Unfortunately, since the pandemic, like the number of calls to us have doubled, like for the last year and a half, but we only have 5% more staff. So it can take as long as 5 days before you'll hear back from us from when you call. So if you can, if it's urgent, let us know that it's urgent. Otherwise, we'll get to you as quickly as we can. Mark's gonna start us off and we'll have time for questions at the end.
Thanks, Barb. You can go ahead to the next slide. Wonderful. So yeah, again, my name is Mark Hengstler. I'm going to go over the basics of the SSDI and the SSI programs. I'll talk a little bit about Medicaid, but mostly turn things over to Barb for discussion of Medicaid and also discussion of unemployment benefits in Vermont right now. So what we're doing to start is a big picture of the Social Security disability programs that exist. The two big programs at Social Security are SSDI and SSI. I'm going to read the large text for both of these first, and then I'll loop back around to some of these smaller points. First, the SSDI program, the Social Security Disability Insurance Program, pays benefits to people and certain family members if those people are insured. Well, I'll get back to that definition in just a minute. This is different than another program through Social Security called the SSI program, the Supplemental Security Income Program, that pays benefits to adults and children with disabilities who have a limited income and resources. The first point I want to flag here is that even though the letter I is in both of these programs. For SSDI, the I stands for insurance, and for SSI, it stands for income. The insurance part of SSDI is a requirement for this benefit that you've worked enough over enough years and have paid enough money into through federal income taxes into the SSDI program. So this is a program that's only for people who are, quote, insured under the Social Security definition, people who have paid enough into the program by working. The SSDI program is very different than the SSI program. And one of the big differences is that the SSDI program pays benefits not just to the insured individual, but in many cases to other people in the insured individual's family. That can include spouse, divorced spouse, child, and adult children who are disabled before the age of 22. Because we're talking about child's benefits today, I'll just briefly flag that a parent receiving SSDI can have some SSDI money go to their child, even if their child is not disabled, just because that child is a dependent. But there's a separate program for adult children, that's the word that Social Security uses, who have a disability. It's a program that allows them to get benefits on a parent's record because the parent is insured. So we'll go more into that later, but I just wanted to flag the main difference between the SSI program and the SSDI program. Next slide, please. All right. So while SSDI and SSI are very different programs, they both start with the same question, which is whether an individual is medically eligible. For both programs, Social Security decides if your child, the person who you're applying for, is disabled, and the definition of disabled or disability in the Social Security program depends on whether your child is a minor or an adult. So the rules that Social Security uses to decide if your child has a disability, and I have quotes around disabled and disability because Social Security has very specific definitions of these terms. The difference between whether your child is a minor or an adult is the difference between how Social Security is evaluating your child's disabled status. Specifically for the SSI program, that's the one that does not require an insured status. Your household must have low income and resources to be eligible. And we'll talk more about the SSI program in a minute. Next slide, please. So here are the definitions. If your child is a minor, your child is disabled in Social Security's language, if your child has a physical or mental condition that very seriously limits her activities, the condition has lasted or is expected to last for 1 year or will result in death. Those are the requirements for minor children. If your child is an adult,
Can I interject for a second, Mark?
Yeah.
One of the things is some people call me and they say, well, my kid is getting special education, so they should definitely meet the definition of disabled for SSI. But the definition of disabled for children and adults is a much harder standard to meet than the definition to get special education. So just because your kiddo gets special education does not mean they're going to be eligible for SSI or SSDI.
Thanks for that clarification. The definition for adults is, I'll read it and then I'll flag what is really the biggest difference here. So for an adult to be defined disabled, your adult child has to not be able to work because of her medical condition, and your child cannot adjust to any other work because of her medical condition, and your child's disability has lasted or is expected to last for 1 year or result in death. The big difference between the minor designation and the adult designation here is that when your child reaches adulthood, Social Security is looking at ability to work. That's the framework that's used. And we'll go to the next slide, and Barb is going to fill us in a little bit more on the disability for minor criteria.
Yeah, so for a minor, Social Security was a program that was really started a long time ago when they thought that people with disabilities wouldn't work. And then it got changed to recognize that sometimes people with disabilities can work. And then it got changed even more to recognize that kids also can need additional income because of their disabilities. But to get benefits for a minor, your child needs to have a marked impairment in 2 out of these 6, or a severe functional impairment in 1 out of these 6. And when they say marked or severe, like severe basically means they pretty much can't do it. And marked means really, really, really difficult. So when you see that, like that your child would have to have a marked impairment in caring for themselves or attending or completing tasks, it can't just be like some attention deficit. It has to be like a more serious disability. And one of the things that gets complicated in this is the younger your kiddo is, the harder to prove. So like a 2-year-old, many 2-year-olds can't do a lot of things. And so the difference between your child and other children is going to be narrower than when your child is like 7. So sometimes for a young kid, they can't really get found eligible, but when they're older, they are more likely to get to be able to be found eligible. Next slide, please. And then I think it's back to Mark.
We're going to briefly go over now the SSI program in some more detail. Your minor child can receive SSI if she meets the definition of disabled that Barb just described, and her household has low resources and income. The SSI program is a means-tested program. Basically, Social Security only pays out the SSI benefit as a payment of last resort. So the SSI benefit can get reduced by a lot of kinds of income or resources. When Social Security is looking at your child's household to determine if your child is eligible financially for SSI, they're not just looking at income your child might have. They're looking at parents, and they're also looking at other children in the household. In this year in Vermont, the maximum monthly benefit for SSI is $846. However, if you have resources that are too high, those resources can make your child completely ineligible for SSI. Even if your child meets the disability criteria, she might not get any benefit from this program because your household has too many resources. In the same way, the SSI amount can be reduced or even reduced to 0 by income in the household. So again, that's not just income that your teenage kid might get from working, it's income that her parents are receiving. Next slide, please. So starting with resources for SSI, I just want to flesh out, when we're talking about resources, what does this actually mean? So first, to be eligible for SSI money, your minor child needs to have less than $2,000 in resources. And when Social Security says resources, they're talking about a lot of things, but the common ones here are money in the bank, stocks and bonds, any property, and any vehicles in the household outside of one vehicle used for transportation. All of those are examples of resources that get counted by Social Security. Now, like we just discussed, resources that aren't your child's but are yours or the parents' can also count as minor child resources. So for a one-parent household, any resources that exist over $2,000 start to count as the child's resources. And for a two-parent household, any resources over $3,000 start to count. So if you have some money set aside in a savings account, Even if it's not a very significant amount of money, it can very quickly make your child ineligible for money through the SSI program. Now that said, there are a lot of exceptions to the resource requirement. There are many kinds of resources that are not counted or that in certain situations do not get counted. We could do a whole other training, I think, just on that one issue. We're not going to be able to go into that in detail, but there are a lot of exceptions to this general rule. Yep, that's it for this slide. Next slide, please. So in the same effect, income for SSI, we'll briefly go over this. If your child earns money, if she's working a part-time job, her SSI benefit amount, which again, maximum is $846 a month, is going to be reduced by roughly 1/2. So if every month she's earning $500 working very part-time somewhere, that 846 benefit is going to be reduced by about half of 500 or $250. If your child gets money though from other sources that are not related to working, her SSI benefit gets reduced a lot more quickly. So for any other sources of income like cash gifts, child support, most income that comes from trusts, the SSI benefit is reduced dollar for dollar. That means that if your child is getting some money from a family trust that was set up and that trust income is more than $846, that's going to make your child ineligible for SSI. Additionally, your income, the income that you earn from work can be, if it's at a certain level, can make your child ineligible. And for that reason, the big picture here is that if your child is receiving SSI benefits, it's very important to report all household resources and income to Social Security and to report any changes in household resources or income to Social Security. Relatively small changes can make a big impact on this benefit. And it's really easy if there's a change in your resources or income for your child to get overpaid SSI, which in many cases results in Social Security issuing a decision that you need to pay that money back. Next slide, please. So we just went over minor children. I want to briefly hit what happens when your child turns 18. So after your child turns 18, Social Security will reevaluate her eligibility for SSI. I'm going to use the term adult child here, so children who are 18 or older. Your adult child can still receive SSI if she meets the disability definition for adults. So again, now Social Security is looking at work, and her household meets the resource and income rules that we just talked about. An adult household, though, is just your child and her spouse. It doesn't include her parents, doesn't include anybody else, even if living in the same house. Other people in the house can affect your child's benefits in other ways, but it doesn't immediately impact benefit eligibility. Again, the SSI benefit amount, $846. The only other thing I'll flag here is that there are some cases where children can turn 18 and still keep SSI for a little while. Those are cases where they're still in high school and finishing high school before the age of 19. Next slide, please. All right, so briefly to go over these again, when your child reaches 18, if she's eligible for SSI, the exact same questions that we talked about before are going to apply. So first, to be eligible for SSI, your child needs to have either less than $2,000 in resources or less than $3,000 in resources if she's married. Again, resources, money in savings accounts, property, stocks. Same resource exclusions apply. And if your child is over-resourced, she's not eligible for SSI. Next slide. The same income rules apply. Roughly 1/2 of a deduction to the benefit for earned income if you're working, and roughly a dollar for dollar reduction for unearned income. However, if your child is 18, 19, 20, and is still living in your house, your income as a parent is not going to be used in the same way to reduce her eligibility for benefit. Your resources also won't be used to evaluate her eligibility. What can affect your child's benefit if she's 18 or over is if she's living in your household and she is not fully contributing to her food or shelter expenses. So if you have your 20-year-old child living in your household, she's living in a room, but she's not paying any rent to you, Social Security is required to reduce the SSI benefit for your child to accommodate for the quote help she's getting from you in paying for food or shelter. For that reason, it's really important to either talk with us or somebody else when those changes are happening to report any food or shelter expenses that your child is not paying to Social Security, and to make sure that they understand that your child, if living with you, is or is not paying rent to you. If your adult child gets married, her spouse's income can reduce her SSI. And again, the big picture here is that it's just very crucial to report any resource or income changes to Social Security. Otherwise, you can end up owing, or your child can end up owing Social Security money. Next slide, please. All right, so we just did a bit of a crash course on SSI, and now I'm going to loop back around and briefly cover the SSDI program. This is the one that requires an insured status from Social Security. So when your child turns 18 and is evaluated under the adult rules for this program, she's also evaluated for SSDI eligibility. Now, if your child is an adult and works for a while, she might end up being eligible for SSDI on her own record because she's paid money through income tax withholdings into the program. But much more commonly at 18, your child might be found eligible for a program called the Disabled Adult Child Program. Now, this is a very specific program with very specific rules, but it can really make a strong positive impact for your adult child's economic security. This is a program that allows your child to receive benefits not on her record because she worked, but on her parent's record because her parent worked. But the very, very important criteria here is that your child's parent has to be insured, has to have worked enough, and has to receive either SSDI, retirement benefits, or be deceased. So only if your child's parent is receiving SSDI, retirement benefits, or is deceased will your child be eligible for this program. There are other requirements too. Your child has to be unmarried, has to meet the disability definition, obviously. The disability has to be shown to exist prior to the age of 22. And your adult child cannot be earning too much money from work. But the money that your child would get from this program under a parent's work record is most commonly about 50% of what the parent is eligible for. Next slide, please. So if your child is getting SSDI on her record or on a parent's record, the Disabled Adult Child Program, those benefits are not subject to any of the resource rules that we just talked about for SSI. Your 20-year-old child, if receiving the DAC benefit, can have $100,000 in the bank, and she's still going to be eligible for this program. In the same way, income that comes from other sources besides work do not impact this program. The only way that your child can lose this benefit is if you lose your, or if you or her other parent loses their benefit, or if your child starts to earn too much money from working. So as with SSI, the really important thing here is to report any wages to Social Security. If your child is 20 and is working and is receiving SSDI, it's very important that Social Security know how much money your child is earning every month.
And I just want to pause and talk for a second about the idea behind this. Remember, I said that this was an old program that's based on the idea that people with disabilities can't work. The idea is if you work too much, then you're no longer considered disabled because your disability is not impacting the ability to work. And that's why if the wages or things like that get too high, it'll be seen that you're no longer disabled in a certain sense.
That's exactly right. And just to flag how important it is to report wages for this program, we see a lot of cases at Legal Services and at Legal Aid where somebody is receiving this benefit, has been working for a long time, and has not been reporting wages. And unfortunately, Social Security is very behind the ball on processing information that come from other sources, like from tax returns or from other parts of the government. So we see a lot of cases where people have been technically ineligible for the program for a long time because they were earning too much money from work, but Social Security found out late. And when that happens, Social Security not only terminates the benefit, which is a really chaotic experience, but they assess an overpayment, or they decide that any money they paid that they shouldn't have is due back to them. There are ways to appeal these decisions, but it's common to see cases where somebody might owe tens of thousands of dollars to Social Security for a long period of time that they were receiving the benefit and not eligible. All right, that's it for, I guess the last point on this slide actually is just that in a lot of cases, especially with this disabled adult child benefit, since that benefit is based on a parent's record and it's only a percentage of the money from the parent's record, it's really common for this benefit to be quite low. And in those cases, where the benefit is less than $846, your child will receive that SSDI benefit. And then if there's no other income, might also receive some SSI to catch them up to that baseline, which is the 846. Next slide, please. All right, so briefly discussing just how to actually apply for these programs. You and your child can apply for all Social Security benefits by calling your local Social Security office. In Vermont, we have 3, one in Burlington, one in Montpelier, and one in Rutland. The best way to apply right now is by phone. So you call, you say you want to apply for benefits, they set up a time to talk with you on the phone. What they do in that phone appointment with the local office is they evaluate eligibility based on these income and resource rules, or based off of how much your child is working, if your child is working. If it looks like your child would be eligible with a favorable disability decision, Social Security gets lots of application information from you and your child, and then sends your child's application to Disability Determination Services, which is an office in Waterbury that processes just the disability determination part of the application. That office in Waterbury is the office that decides if your child meets the criteria for disability under the Social Security programs. And it often takes many, many months to get a decision from DDS. So once the application is in, once everything is in, there's a long wait. And then eventually a decision comes from DDS back to the local office. And what you get in the mail is a letter from the local office saying whether or not your child was found eligible. Next slide, please. All right, last one for me, and then I'll turn it over to Barb. How are these programs related to Medicaid and Medicare? SSI is relatively simple. So if your child has SSI, she will automatically be enrolled into Medicaid. And that's it. There's no other application for Medicaid. It just happens automatically. If your child has SSDI, which includes that disabled adult child benefit, she will likely be enrolled not into Medicaid, but into Medicare. And that'll be after 2 years of being in the receiving benefit in this program. So there's a 24-month waiting period for Medicare. Important here is that it's very common for people to have Medicaid and Medicare at the same time. So while your child is waiting for enrollment into Medicare, and even after she's enrolled into Medicare, she might still be eligible for Medicaid. But if she's not receiving any SSI benefit, then she needs to apply for Medicaid separately. Medicaid and Medicare are very different programs, and we're not going too far into the weeds for those, but I will turn it over to Barb here to discuss a little bit more about Medicaid and other programs.
So next slide, please. So I'm going to talk now about sort of the working relationship with Medicaid, and then working relationships with the Social Security programs. And then I'm going to go on to talk a little bit about unemployment compensation and how that intersects for applying for unemployment and getting unemployment for people with disabilities. So those are the next things I'm going to talk about. So there is a program in Vermont called Medicaid for Working People with Disabilities. And the thing that's good about it is that it has a much higher income and resource limit than regular Medicaid, which is a really good thing, because people can, in other states, you can lose your Medicaid if you work too much. And if you're a person with a disability, often Medicaid is the most important public assistance benefit that you get, and people really don't want to lose their Medicaid. So to get Medicaid for working people with disabilities, the applicant has to be working. That's the working people with disabilities piece. The income limit is 250% of poverty. That's for a one-person household, that's about $2,600. There's higher resource limits. Remember how we talked before about how low the resources needed to be? Here, the resource limits are higher. And you still have to have that determination of disability. Usually that happens through receiving SSD or SSDI. And there's no minimum hours or earnings requirement. Most people in my experience were getting SSDI or SSI, get a job, the job becomes significant enough that they're getting higher income and they lose their regular Medicaid, but then they became eligible for Medicaid for working people with disabilities. That's kind of the usual path on for that. Next slide, please. So remember how we talked about for SSDI and SSI, the idea is that you are a person who is disabled. And remember how we talked about these are old programs that have this idea that disabled people don't work. Well, if you work some, you can still keep your benefits as long as you're not working too much. Well, what's too much? Too much is what that is called substantial gainful activity. And substantial gainful activity is basically if you work so much that you're getting however Social Security decides is too much money, then you're no longer considered disabled because you're doing substantial gainful activity. For right now, the substantial gainful activity limit is $1,310. So a lot of people who are trying to keep their SSDI or their SSI will keep their work below that $1,300 in order to keep their benefits flowing the way they need them to. Next slide, please. Okay, so we're done with the SSDI and the SSI, and now we're going to talk about unemployment compensation. So a lot of people with disabilities were working, and just like everyone else during the pandemic, a lot of people lost their jobs because the places they were working shut down. And so during the pandemic, there were special unemployment compensation rules that allowed a lot more people to be eligible for unemployment compensation. And so I think a lot of us are aware of folks who work, 10 hours a week at jobs, and those jobs got shut down just like other jobs got shut down during sort of the high point of the pandemic when people lost their jobs that way. Even though they were very low wage earners, they could still get special federal unemployment compensation. That special federal unemployment compensation for very low wage workers, those rules are no longer in place. So we're back to the regular old unemployment rules that existed before the pandemic. Well, we're still in the pandemic, but before March of 2020, we're back to the regular old rules. And so some things that we've all learned about unemployment compensation during this pandemic aren't true anymore. So I'm just telling you that. Now we're going to go into the regular old rules. So next slide, please. So who is eligible for unemployment? You must have, there's some key elements. You must have earned a minimum amount of wages in your base period, which is essentially the last 18 months. You have to have worked enough in the last 18 months to be eligible. You must be able and available to work, and we're going to talk more about that. And the separation from employment must not be your fault. So if you quit a job, unless there is a reason that is considered to be the fault of the employer that you quit your job, for the most part, you're not going to get unemployment compensation. Next slide, please. Okay, able and available to work. So this is interesting, right? Especially for people with disabilities. So I'm going to explain it in general, and then I'll have to be able to work. That means that you can work a job. You can work a job with accommodations. You can work a job that meets your skill level and needs, but you have to be able to work and you have to be available to work. So if you are in the hospital, laid up, and you're going to be in the hospital for 2 months, and you're going to be knocked out most of that time, you are not able to work, right? You're not able to work right then. So you wouldn't be eligible for unemployment compensation. If you live in a teepee without internet connection, 100 miles away from anyone else, you are not available to work. Even though you're completely able to work, you're not available to do a job. So able and available to work means that you are ready to work and you would take a suitable job if one was offered to you. And a suitable job is one that matches your skills, abilities, or one that's consistent with your work history. Now, for a lot of people with disabilities, they're working part-time jobs. They've been working part-time jobs. They only need to be able and available for part-time work in order to be eligible for unemployment compensation. You don't need to have worked part-time for the last 3 years, lose your job. Then you would still need to just be able and available to do the same kind of work you did before. Next slide, please. One of the things also is you have to do a work search. So while you're unemployed, you have to be looking for work. So before, during the height of the pandemic, that work search rule was suspended. That's now back into effect. So while you're unemployed, you have to be actively looking for a job to get unemployment compensation. Now, you can be actively looking for a job that meets your skills and abilities and that will accommodate your disability and that will be, part-time if you're working part-time before, but you have to be engaged in an active work search. Next slide, please. So what is a work search? A work search is 3 job contacts a week. And basically that means applying for 3 jobs a week. Applying for 3 jobs that you have a chance of getting. Like if I was unemployed and I applied, if I applied to be a surgeon at the hospital, I don't have the skills for that. I'm not going to get the job as a surgeon as a hospital. So that is not a work search. I have to be applying for jobs that I could do if I got them. And you report them through a weekly online certification. You can also do call-in reporting. It's a little more frustrating, but people have to report that they are looking for work. Next slide, please. There is an exception for people with disabilities because for most people with disabilities, getting work is not like cold applying to 3 jobs. More often it is actively working with a disability assistance agency to get a job, either through the community mental health agency or vocational rehabilitation or some agency. So if the person has a disability and they're actively engaged with any supported employment agency and they're actively looking for work with that supported agency, then they don't have to do the 3 job contacts a week. The supported employment agency will provide a letter to the Department of Labor through this way that they've been trained to do, that says, we're working with Barb Prine, we're helping her to try to find a job, and she's actively working with us. And that's enough to meet the work search requirements. Next slide, please. So this exception, we call it the voc rehab exception, but it also works for people who are working with like a community mental health center like Howard or Washington County Mental Health, Rutland Mental Health, one of those places. If that exception only works if someone is actively engaged. So if someone is like not really working with their agency, they don't get that exception. This is the call that number 2 is the call we get a lot. Sometimes people feel like, Paul's living with me. I'm the shared living provider for Paul. Paul wants to go back to work, but I, as the shared living provider, don't feel safe with him going back to work because I'm scared because of COVID. And so I say that I don't want him to go back to work. If a family member or a shared living provider is saying you can't go back to work because we're scared because of COVID, then that person is no longer eligible for unemployment. They have to be willing to take a job if one was offered to them in order to get unemployment compensations. So if a person would not return to work right now, if offered a suitable job, that person is not eligible for unemployment compensation. So I think that's our last slide. I'm sorry that these rules are so complicated and that it kind of feels like we're describing all the barriers to getting the assistance that people need. But we just want you to know what you're up against and what it takes to get some of these benefit programs. So anyway, we're just here to explain things, but I am sorry. It especially when we're saying them all at once, it sounds it sounds like, because it is a very bureaucratic system that's about proving that you are worthy, and it's kind of yucky, but it is what it is. Okay. Questions?
Thank you both so much. I did want to mention that we will be sharing these slides. There's a ton of information that you have given, and I'm trying to take notes, but keep in mind that we will be sending out the slides as well, so you can have them for reference. In the chat box, I did put the intake number and the 800 number, that if you wanted to call and complete the intake process, that information is there. We do have one question in the chat that I will read, and that is, can a parent still claim an adult child who is receiving SSI?
And does that mean claim for tax benefits? Is
I
that what the claim means? That's my
so.
guess.
Yes, that's what it would mean for, on the taxes as an adult child.
And can they claim still if the adult child is getting SSI, can they claim them for tax purposes? I think, Mark, sometimes they can.
Yeah, I think the short answer is I guess my short answer is it's a great question. It's a tax question. I'm not my knowledge of tax law is a little bit shaky. To my recollection, there are rules that allow an adult and a parent to claim an adult child with a disability. The way to find that out would be when filing taxes, asking your tax preparer that question. I'm pretty confident that all tax reporting software has questions that guide through that area. But I don't have the answer off the top of my head. I forget what the requirements are.
The next question we have is how far in advance of age 18 should a family youth apply for SSI determination as an adult?
Barb, do you want to take that one or should I? Oh, seems like we lost your audio. So how far in advance of age 18 should a family or youth apply for SSI as an adult? That's a good question. I'll be really transparent. The scope of my work is helping people who already have benefits and who either lose their Social Security benefit or owe Social Security money. So I am not the expert on kind of the nitty-gritty process for applications. I think that it's worth calling the local office to get some guidance on that. That would be kind of my best advice. Barb might have more.
Barb did offer in the chat that she thinks 4 to 5 months before.
Thanks, Barb.
Okay, and then the next question is, does a parent lose their Social Security benefits if they have an adult child on SSI?
No, if a parent is receiving retirement benefits or disability benefits, SSDI, through Social Security, and their child starts to get benefits too, that does not reduce the parent's benefits. There are some rare situations where a parent is receiving benefits either through retirement or disability insurance and has multiple children or multiple people receiving benefits on their record. In those cases, the people receiving benefits can have a reduced benefit. There's a family maximum rule that can apply in some cases, but the parent's benefit, the primary earner's benefit, remains the same no matter what.
There was a comment, I guess I'm not sure if this was clarifying something here or if it's a question, but definition of dependent by IRS. I guess are you looking for the definition of dependent?
No, so I think that I had stuck that in there with the tax question, because that would be dependent on the definition of dependent by the IRS, as you can claim your adult child on your taxes.
Okay. Barb had also offered, in addition to applying 4 to 5 months before the child turns 18, that the child does not already have disability benefits. It was asked if you could provide a link to more information about what is and is not counted as a resource.
I can. I'm going to post right now in the chat a page on the Social Security website that gives a really down and dirty overview. This is not hyper detailed, but it'll give you some really good ideas of kind of the buckets for what gets counted and what doesn't. Unfortunately, some of these get really, really specific, especially with more complex resources like trusts. So those questions are really hard to answer on a broad basis.
I have another comment. It says, I'm unclear about income thresholds. If I receive $1,100 per month in child support for 2 children, how is that counted toward SSI, SSDI? One child is disabled and the other isn't. No other income at this time beyond child support. Okay.
This is a great question that's specific enough that I would need to probably look up some things to answer your exact question. So with that question in mind, if you call our number or if you do the intake on our website, we would call you back and we could just give you some brief advice about that one. That'd be easy for us to do. I can say broadly, big picture, if a parent is receiving income from child support or even from spousal maintenance and has children who are eligible and receiving SSI, what can happen is the income that the parent is receiving, the unearned income, which is child support or spousal maintenance, can be what's called deemed to the child receiving SSI and reduce the child's SSI allowance, reduce the amount the child's eligible for. As Barb has said a few times, these rules are not only really old, they're also very wonky, and they're very nitpicky and specific, and there's often a lot of math. So the answering individual questions usually involves like sitting down and getting numbers and kind of going through them.
Barb had also offered that you all don't know enough to answer the tax question on what is a dependent for the IRS. And then for anybody that hasn't seen it, Mark did put the Social Security website in there. And Barb offered vermontlawhelp.org as another resource. That does get us through all of our questions. I guess we can give just another moment if there's other additional questions, or I think everybody has the ability to unmute if you wanted to ask a question directly. So there is another one that just came in. Can an adult child's SSDI determination be made off of one parent versus the other parent if the parents are divorced? For example, one divorced parent has worked 25 years plus full time, and the other divorced parent was an at-home mom. The adult child currently lives with the mother who only worked on and off over the last 20 years, and the divorced father lives out of state and is still working. No child support is being received at present, but alimony is being received.
So because this is a question about SSDI on a parent's record, the benefit we're talking about is the disabled adult child benefit. And the rule for this benefit, again, this is an SSDI benefit, so it's not the SSI one with specific income and resource rules. The rule for this benefit is that if a parent of the child who has a disability, if a parent is either receiving SSDI or is receiving retirement benefits from Social Security or is deceased, the adult child who has a disability can be eligible for benefits on the parent's work record. When Social Security is making this determination, it is not looking at who lives in the household the same way that it is for SSI calculations. It's purely looking at the parents of the child and their individual work records. So if both parents are receiving retirement and one of them is receiving a higher number, the other one is receiving a lower number, Social Security is not going to look at whose household the child lives in, the adult child. They're just going to look at which benefit's going to be more for the adult child, and they're going to pay off of that record. So that's the way that those get dealt with.
Great. Any other questions? Barb, are you back? No, we still can't hear you.
Well, thanks so much, everybody, for taking the time, and certainly a brief overview of our offices. Again, we help out in a lot of cases where people are receiving Social Security benefits and have problems with their benefits. The same is true for unemployment compensation for people who are receiving benefits or get denied benefits and are trying to get them. So feel free to call either our main line or visit our website to get some help from us if you need it.
Great. Well, thank you, Barb and Mark, for today's informative workshop. So much great information. We really appreciate your time today. You'll see a link to an evaluation in the chat. Please take a few minutes to complete it so we can make improvements and fulfill our grant requirements. And we do have more interesting workshops coming up if you can, and you can find details about those on the homepage of our website, which is vermontfamilynetwork.org, along with the links to previously recorded ones. We have tons of information on our website, and getting connected with us is easy. You can follow up on Facebook or join our closed Facebook page if you are a parent. We have 2 closed groups, one for all parents of children with disabilities and special health needs, and one for those with adult children. You can also sign up for our monthly e-news or check out our YouTube channel. So we are here to help. Please contact us by phone or email. And thanks again, everyone, and have a great day.